Okay, good morning. My name is Jack Shaw, and this is my friend Samir Damani. I'll introduce us in a little more detail in just a minute, but welcome to the session on Discover How Blockchain and Token Incentives Will Revolutionize Chronic Disease Care. If that's the session you're looking for, you are in the right place. You may have been expecting a panel discussion. Unfortunately, a couple of our panelists were not able to join us today, so instead I'm going to be doing a fireside chat type interview with Samir. We are going to have time for questions and answers at the end of the session, and the conference organizers have asked us to please remind you to take a minute to fill out the evaluation forms at the end of the session, if you would please do that. So allow me to introduce myself first. Again, my name is Jack Shaw. I'm a technology futurist and have been so for some 30 years, working with emerging technologies. A couple of years ago, I founded the American Blockchain Council. The American Blockchain Council focuses on helping senior-level executive strategic decision makers understand the business implications of emerging technologies in healthcare, as well as in many other industries. If you'd like to find out more about the American Blockchain Council and the work we do later, please see me after the session, give me your card. I'd be happy to chat with you about it. Let me then also introduce Samir. Dr. Samir Damani has extensive medical training, including receiving his MD from the Medical College of Georgia School of Medicine. He has a doctorate in pharmacy from the University of Georgia, and he has a master's in clinical investigation from the Scripps Research Institute. And I'm guessing from looking at you, Samir, that you must have started all that about age 5 to be that accomplished at this young point in your life. Either that or you're extraordinarily well preserved for such an old guy. After years as a practicing cardiologist, frustrated with the approaches to chronic disease management, Samir founded MD Revolution, which is a leading tech-enabled services platform for Medicare's chronic care management program. And it's now leveraged by thousands of patients and providers across the nation. He also remains highly active as a board member of MD Revolution, and he serves as a clinical instructor in the Department of Family and Preventive Medicine for the University of California, San Diego Medical School. He is a board-certified practicing cardiologist at Scripps Clinic. So he's certainly well qualified from both a medical and from an analytical and technology perspective to help us understand the implications of blockchain technology. A couple of years ago, no less reputable an organization than The Economist magazine, than The Economist magazine stated that blockchain technology was the most important advance in record keeping since the invention of the double entry bookkeeping system in Florence, Italy in 1494, over 500 years ago. Quite an extraordinary endorsement, and with good reason, because blockchain technologies enable us to do 4 things that we have not been able to do, certainly not together, certainly not as well as can be done with blockchain technology. First of all, blockchains enable you to create permanent, immutable, signed and time-stamped records of identity, ownership, transactions, or contractual commitments. Secondly, that information, those records, can be shared among 2 or more entities, people, organizations, patients, doctors, clinics, hospitals, payers, insurance companies, employers, without having to depend on a third-party intermediary to provide paid services for maintaining the master record, and without having to depend on any one of the other participants in the ecosystem to maintain master records for everyone. That information then can be made globally and transparently available to everyone in this case, the healthcare ecosystem, who is authorized to see that information. And for that subset of those that are authorized to update that information, to provide new information, for them to be able to do so, while at the same time providing unhackable security against anyone changing or updating that information who's not authorized to do so, or even seeing it if they're not authorized to do so. Now, naturally, as soon as I use the word unhackable, people will say, well, given enough time and resources, any computer can be hacked, right? And that's the beauty of blockchain, because blockchain information is not stored on any computer. It's stored on many computers. Using the most advanced cryptographic and synchronization technologies in the world, every time information is added to blockchain data, that information is replicated identically at anywhere from dozens to hundreds to thousands of computer systems and sites on the internet, otherwise referred to as nodes, all over the world. If anyone were to try to successfully break into any one of those nodes and access data or make changes that change the information there, it would no longer match the information on the rest of the nodes and would simply be rejected. So if someone were to hack a blockchain, it would require them to hack 51% or more of the nodes all at the same time and get it all done very quickly. In the case of the largest and oldest blockchain that's out there, for example, which is the Bitcoin blockchain, which certainly many of you have heard, probably everybody by now, of the digital currency of Bitcoin. In the 8 years since Bitcoin came out, it has never been hacked. The reason is you would have to hack a majority of the 7,000 nodes of the Bitcoin blockchain, but it synchronizes every 10 minutes. So you'd have to hack all of those nodes at the same time and get all of those hacks completed identically in less than 10 minutes. One physicist estimated that the amount of energy that would be required to drive the amount of computing power that would be needed to simultaneously hack all those thousands of sites, update them identically, and change them in less than 10 minutes is approximately equal to the amount of energy emitted during the same period of time by the sun. So while you might argue, well, that theoretically it might still be possible to hack blockchains, from a practical perspective, it is economically impossible. And that is one of the key things that is driving the adoption of blockchain technologies. Now, over the last several years, a number of very powerful use cases have emerged in the healthcare field for blockchain. Deloitte did an outstanding study, and Samir, they can download a copy of that study from your website, isn't that correct?
I don't think so.
Not from your website. Okay, well,
Get it, yeah.
all right, you sent me a copy. That's where I misunderstood. But you will be able to, you can access the full study if you wish, where they brought some of the industry experts together to identify key use cases. And one major use case dominated the discussion how blockchain could facilitate the creation of a more comprehensive, secure, and interoperable repository of health information. The other remaining use cases often depend on blockchain-based health data collection and policy execution, but they show how it can be used to streamline back-office operations, to provide more effective, cost-effective underwriting, pricing, and claims functions, as well as enabling value-based care strategies, improving capabilities to deter and detect fraud by providers, claimants, or applicants, upgrading the reliability of provider directories for health plans and for patients, simplifying and shortening the insurance application process to make it more customer-friendly, supporting the formation and growth of online insurance exchanges and alternative forms of insurance, such as peer-to-peer coverage groups, and facilitating the near real-time health status monitoring and more dynamic pricing and interactive services by insurers. Now, Samir is going to take it from here. He's going to talk to you a little bit about how his company, Mint Health, has developed a solution that leverages blockchain technology to provide some extremely powerful capabilities in the chronic disease management space. And then once he's covered that material, I'll have a few questions for him, and then we will open it up to the audience for questions. Samir, all yours.
Thanks, Jack.
Could I grab one of those waters, please? Sure. Thank you, sir.
Let's see, move back here so I can look at my screen here. Okay. All right, great. Well, thank you, everyone. Thanks, Jack, for that introduction and that background on blockchain technology. I think that's really key. It's a buzzword that's been used a lot lately, but it is more than just hype. When you talk about, and what we're going to talk about in a few minutes, I want to kind of make a distinction for everyone in the audience that there's cryptocurrencies and there's blockchain, and they're not the same. You know, a cryptocurrency is it's a digital asset. It's a creation of a financial reward system that can be used by leveraging the existing blockchain. The blockchain is really just a decentralized ledger. So what we're going to talk about today is how can you use a digital asset or a token incentive model and a blockchain to create a system which aligns all stakeholders in healthcare. And one of the big issues that we all know is that historically healthcare stakeholders have been misaligned. You know, if a payer frequently wins, the patient may be missing out, you know, and if a provider wins, the patient isn't necessarily benefiting. So how can we create a token incentive system that really aligns all stakeholders? And that's happening today with chronic care management programs, where now providers are getting reimbursed for providing chronic care management. Patients are getting better, they're staying out of the hospitals and health systems, and payers are saving dollars. So now there's an alignment there. But the reality is that the tangible benefit, the financial remuneration, is being missed by the patient. Yeah, they're avoiding the hospitals, they're avoiding the EDs, but is there a way we can start to incentivize them to do the kinds of things that we know we want them to do? And that's really what Mint Health is all about. There's a token side, the token incentive model, which is the alignment model, and there's a blockchain aspect of it, which you need in order for data to flow seamlessly between all the stakeholders. So I'll go into that more. A little bit background in terms of what Mint Health is. We're bringing together essentially two major companies. One is MD Revolution, Jack alluded to it earlier, which is a chronic care management technology-enabled services platform that I founded in 2011. We've engaged over 30,000 patients over the last 5 years in a variety of formats, everything from corporate wellness environments to now we're focusing on Medicare chronic care management codes. We do chronic care management, behavioral health, and also complex chronic care management. We're also rolling out heart failure management models. And so we're bringing that technology and that expertise to Mint Health through a licensing arrangement. And then the other company is Nucleus Health, which has over 400 facilities where they've created a patented streaming mechanism where you're able to take really large complex data sets, and I'll talk about that in a moment and why that's actually relevant, and actually stream it from the cloud into a web-like browser at diagnostic quality in near instantaneous fashion. And so they have, again, 400 health systems. And so we're bringing that technology to structure the data to create a personal health record so that patients can really store their personal data in the cloud, protect it with the blockchain, and then share it with whomever they need to in real time. And then finally, if you take those two technologies and you add the blockchain element, and we'll go into in a moment why that's relevant, you now have essentially what Mint Health is. Looks like it's moving forward. There we go. So why is this relevant? I mean, I don't probably need to tell everyone in this audience this, but the reality is that we're in a global healthcare crisis. 56 million people died in 2012, 40 million of those per the Lancet, were from chronic conditions. And what's amazing is that this really is global. I mean, while most of you are thinking the US, and certainly, you know, in the Medicare population, over 90% of our patients have at least one chronic condition, but 4 out of 5 deaths from chronic conditions occur in the developing world too. And so Mint Health is not only about tokenizing incentive models and building models for data liquidity around in the US, but also globally. And the most compelling piece of this is that if you think about the last 100 years, people were dying from smallpox, typhoid, cholera, tuberculosis, and these are communicable conditions. In fact, just in the 20th century alone, there were 300 million people that died from smallpox. They're not dying from these conditions, so they're dying from behavioral diseases like diabetes, heart disease, stroke, cancer. And if you look at the World Health Organization, the CDC, and I see this, in fact, I still maintain a cardiology practice at Scripps, and that was really what drove me to realize that, you know, these are preventable conditions. 80% of diabetes and heart disease is preventable, 40% of all cancers. And so, you know, not only are you talking about the long-term prevention, but you're also talking about the short-term interventions that can occur in terms of keeping patients out of the hospital. You have the long-term benefits that can be applied if you can really build a pop health program or care management program that is trying to change behavior, and a reward system is a piece of it, gamification is a piece of it, and then human interaction. And how do you scale that human interaction that's so important to patients with multiple chronic conditions who typically lack awareness and accountability? So, you know, it's a little hard to see here. Okay, here we go. So when you think about, you know, what blockchain can do, it creates an opportunity, I'll go in how, to really have a self-sovereign health record and a single global unique identifier. It allows for the seamless and secure transfer of clinical and behavioral data between patient authorized, and that's a key, patient authorized stakeholders, and the incentive model through digital tokens that reward proactive and positive behaviors. And that's the key for blockchain. I'll go into more detail on how the blockchain can actually administer that. So as Jack talked to you about, I won't spend a lot of time, but it's basically a ledger system is what the blockchain, an open source ledger system that can't be hacked. So if you think about HIPAA and why data has historically been kept in EHRs, a big reason has been security. And so what blockchain can do now is it allows you to put data in the cloud, which is encrypted at rest, encrypted at transit, protect it with the blockchain, and use smart contracts within the blockchain to actually add permissions in real time. So, you know, if Mary sees Dr. Jones as a primary care physician, 4 weeks later she sees a cardiologist as a different EHR system, she can share the imaging data, she can share medication or lab data, and also her patient-generated data in real time. And that's really what blockchain can do in healthcare. But at the end of the day, what it does in general is it allows for the transaction of information without needing a middle person. And that's really the key here, because like Jack said, what you're operating off of and what you're leveraging is something called nodes. And so this is typically how it works. You know, someone requests a transaction. It could be a patient or it could be a provider asking for data from a patient. That transaction is broadcast to these nodes across the world. The network of nodes then sees within the smart contract that that person actually has access or permission to access the data. Okay, then once the nodes verify that, the block is added and you can access the data. So now if I'm a patient, I want to add someone in real time, I can just simply broadcast it to the network. It adds Dr. Smith to the actual blockchain, and now Dr. Smith can access the data because it's now embedded within the blockchain. That can't be hacked. And so there's a global HIPAA log that's traced, that's open source. And if you guys go to Etherscan or some of the actual open source, you can see every transaction of Ethereum or Bitcoin ever done and who's going to who. And it's all encrypted because you're using public keys and private keys, which we won't go into. But that's the beauty of what the blockchain, again, it frees up data which have typically been in silos. So you're going from this model where left, you're waiting on the EHR, the clinical administrative system, to the right, where now data is flowing seamlessly between all the different stakeholders. And this is not just health systems and doctors' offices, this is pharma. You know, these are all the entities that might want to access the data, can access it, and the beauty in this ecosystem is that patients control it. So if pharma wants to get to it, or anybody else, patients can decide to share it in exchange for a digital asset or a currency, then that has value. So again, it's about a patient health record that has been tried in the past, but there's never been this token incentive to actually make it work. So here's the reality of today, and I always use the example of Mary. Mary is a diabetic female with hypertension, uncontrolled blood pressure, who sees Dr. Jones, and her medications are probably listed in one area, her medical imaging in another area. She's got, her blood pressure information is on Health Kit or on a pad at home. Her specialist data is somewhere else. You're talking about the average provider is frustrated. They're making decisions in a vacuum, and what typically happens in this situation, I see this, even at Scripps, which is a top 20 heart hospital, we see this. It was where patients come in, they don't have access to the data, so they lack an awareness, yet they have chronic conditions, and they should be in control and be empowered, but instead they think of chronic disease as something that happens to them versus something they control. And so you have a passivity that is pervasive among patients with chronic conditions, and they tend to lack awareness and accountability for that reason. And it's a vicious cycle that I saw happen over and over again, and my colleagues, benefit because they get paid to treat disease. And the system is so perverse that the incentives have been misaligned. And we're starting to see with some of the stuff you've heard about with the merit-based incentive payment system, the MACRA system, the QPP programs, chronic care management, because you're starting to realign, starting to incentivize the right kinds of things for physicians to do, but it's taking time. But historically it hasn't been there. So you've got frustrated patients. So what blockchain can actually do is it can now break down these data silos. Why? Because Mary goes to Dr. Jones, okay? Dr. Jones now scans her QR code from her Mint Health application, and we're able to, through an integration, through a CCD exchange, pull the data right into the cloud. So you get your medication, your lab data, your medical imaging data. This is where Nucleus Health, the other foundational ecosystem partner that we have, comes into play. And now you're also combining her MyFitnessPal information, her blood pressure information through the app that she actually logs on her app, her weight data. She's a heart failure patient, her salt intake, her swelling level, right? You get all this patient-generated information with clinical data that now, and oh, by the way, the echocardiogram, I recently talked to a large health system, I won't say the name, but very, very sophisticated health system that has 3 different EHRs for the same health system. So now the echocardiogram that Dr. Jones does on her heart, because she's got, mild heart failure, goes to the cloud as well. So 6 weeks later, she goes to see Dr. Smith, who's a cardiologist, and her blood pressure is uncontrolled, and she's short of breath. Instead of reordering the echocardiogram, within the app, we can actually see the actual echocardiogram at diagnostic quality. He can download what her blood pressures were at home, right from that same thing. And not only that, but Mary can add Dr. Smith onto the blockchain right then and there through the app by scanning his QR code. So now his data goes to the cloud and combines with the previous sets of data. And all this is being done with Nucleus because we have structured data formats. This is very well documented within medical imaging. So the metadata, everything goes to the cloud. And now Mary has Dr. Jones and Dr. Smith's data, right? And at the same time, Dr. Smith sees, well, her blood pressures are actually only high in the evening because she takes her medicine in the morning. So what she has to do now is simply take a twice-a-day drug that has a longer half-life. So that fixes that problem. It avoids redundancy of testing. And now Mary's more in charge because she realizes that her home blood pressure readings are actually the reason why she got the treatment she needed. And she had the echo. She sees the echo. She had it. She was able to share it. And this data set is growing over time. And so that's where blockchain is going to revolutionize how we manage patients, is through the patient-controlled health record, right? And at the same time, and I'll go in a minute here, Mary's getting tokens. She's getting vitamins. So our token's called vitamins, so VIDAMINTS. And the whole idea here is that we're going to go to a local plan. One of the plans that we're talking to is Sharp Healthcare in San Diego, right? And so Sharp is a plan. They have at-risk, any entity. We're also partners with Arch Healthcare in San Diego, which is an ACO. So anyone taking on risk, now we will airdrop as a pilot tokens to actually incentivize the population And we'll be focusing on heart failure patients. We'll take a heart failure patient and make sure they're weighing themselves every day, and they'll get tokens for doing that, right? They'll get tokens for checking their blood pressure. They'll get tokens for actually logging their salt. And there's going to be social aspects, so they're able to invite their caregivers, their spouses, their kids to their social community on this app. So not only are you building this database and the repository for them to control, but you're building the social and the gamification elements. And those tokens can be redeemed. They can be redeemed for prescription refills. They can be redeemed for copays. They can be redeemed for premium reductions in self-insured companies. Or if you're in case of Sharp, you can reduce your health plan costs, right? So now as a health plan, you're more competitive in the marketplace, right? Because now you have a plan that actually allows patients to self-select for who's actually going to be managing themselves better. So now, going back to my first slide, the misalignment, right? Patients get to participate in the actual process around saving costs and actually generating value and a redemption option that they can have, right? And so we're talking to Amazon, we're talking to a number of other entities. Another perfect example is an entity like Aetna and CVS. You can imagine where Aetna as a payer is incentivizing through tokens, and then you're going to CVS to redeem your tokens. And if you've been following and getting your tokens, now you're creating an economy, right? A token economy. So again, separate from blockchain, this is a token economy, right? The token economy, if healthcare is growing at 5% annual GDP, and a token, right, can actually go to 4.75%. Now the people who hold the token have greater value, right? So unlike fintech, which is where you hear so much about blockchain, and I tell people, I told MIT Tech Review the other day, I said, honestly, I think the transformational potential for blockchain and cryptocurrencies in healthcare is far greater than it is in fintech. And the reason why is because the biggest pockets in healthcare today, which are whom? They're the payers, they're the health systems, they're the pharma companies, are actually the ones that want to buy the tokens because they see that their dollar per dollar cost is going to result in a ROI. So you say, okay, well, how do you know you're going to get an ROI? Well, that's where MD Revolution comes in. We've shown in a Mississippi population that the Medicare Chronic Care Management Program, in a 3,500 patient population, it cost $750,000 over an 8-month period. We saw $3.5 million in inpatient hospitalization reductions. So now we're like, now imagine what you can do in a commercial population with that data if you're actually incentivizing and you're gamifying that experience. We're already seeing by just simply calling patients and using our CRM tool, we're able to drive outcomes. So that's where you start really thinking about, wow, a patient control record where now you have gamification and incentive models, where there's redemption options, right? And then they're like, well, why don't you just do a Sky Miles program? Patients can do that. Well, the difference with that is that you have to have something that can administer, and the blockchain can make sure you're not using that currency in 2 different places. Double spending, double receiving. So the blockchain can administer that token economy, right?
Samir, we've got about 10 minutes or so left, so I was going to suggest perhaps we can hit a couple of key items via questions.
Let me go through a couple more slides and then we'll get there. Because I think.
Pardon?
About 5 minutes.
Okay.
Yeah. So the important thing I think to realize is that, and I'll just stop right here, is that at the end of the day, by creating this data repository where patients can control it, the thing that's very interesting is we met with Novartis, in fact, met with the Novartis CEO, and there's intense interest in data sets. So now if patients can become in control of sharing their data sets and are getting remunerated, now you're not having entities that are actually controlling the sharing of that data. So now patients get to decide who they're going to give that data to. And that was a thing that I think is very powerful. And blockchain is really about decentralization and the automatic execution of transactions. So you don't need a middleman anymore. So anyway, with that, I'll stop.
All right, great. Well, let me ask you a little bit about the company first, and then we'll take it over to the audience for their questions. So couple questions. One, is it simply the Mint Health app we're talking about, or what more is there that's being developed? How do you interact with other businesses? And secondly, then, can you tell us a little bit about what you see as some of the key project milestones over the first half of this year, the first and second quarter of 2018?
No, great question. So we're building an ecosystem. So in 2018, one of the major things we're doing is we're partnering with innovative partners that want to pilot a program. We're looking at at-risk entities or entities that are managing at-risk programs that are interested in using a digital asset and the blockchain to actually facilitate the model we just talked about to see where we can drive down costs. So we are partnering with a number of organizations. So that's one thing. The other thing too is we also don't see this as solely for patients with multiple chronic conditions. So we're building a community, and you can join our Telegram community actually, but importantly we'll have an app that anyone can use. In fact, there's one of the most downloaded apps in the App Store now is simply people who can earn digital assets for doing certain things. So we are trying to make this not just about chronic conditions, although that's our focus when we're dealing with at-risk populations. We want everyone in this room, anywhere in the world, to be able to download the app. So in the next 90 to 120 days, we'll have an MVP out.
Go ahead, yes, exactly. I can open it up to questions, and I'm going to repeat the questions so we capture them for the video recording. And the gentleman up in front. All right, well, let me take for the moment, in the back. Yes, sir, with the red tie.
Yes, my question is about whether you see a risk on the concept of proprietary taking over the potential or limiting the potential of the application of blockchain. And what I mean by that is that there may be a human element, I guess, that is fundamentally necessary for all this to work, which is that there is a willingness to share information and to provide access to the ledgers openly, right? But if you develop this community, or if certain banks are using the blockchain technology in a way that is proprietary and is closed, then it kind of defeats the purpose. I guess in a way,
Right.
we've had the ability of exchanging information between EHRs, for example, for a long time, and we aren't doing it.
Right. So
Well,
so I
let's
think,
summarize the question so
Yeah.
they can hear it in the video. If I understand what you're saying is, you have a concern what happens if a proprietary tool or technology or company takes over the ecosystem, even though it's blockchain enabled. Have we defeated the system by doing that? Is that a... Yeah, right. Okay,
No, that's a
Samir?
great question. And in fact, that's what's so great. I mean, blockchain really came out, Bitcoin came out in the wake of the recession, where they realized that centralized authorities abused their authority, and really there's tendency for fraud. And so to your point, absolutely. So we are actually building our application on the Ethereum network. So it's an open source network. If Mint Health goes away, patients still have their data in the cloud. It's going to be, right now we're working with Azure Cloud, and the global CISO for Microsoft is on our advisory board, but we're looking at distributed storage companies like Sia and Filecoin. So we're actually nothing that we're doing is going to be controlled by us. It's all about patient control. And if we went away, the patients still have their health records up in the cloud. They would just have to take on probably some of the costs of storage. But the reality is that we haven't worked through exactly how that would work, but right now it's all on open source.
So in effect, you make your money by providing tools that participants in the process can use to access that shared data if they're authorized to do so.
Well, our goal is exactly, we are transacting, you're helping transact the ecosystem, right? Because you're going to need an app that actually can gamify things, can have the social elements. The reality is we also don't control the data. The patients can only decide they want to share it. So if Novartis wants to look at 10,000 heart failure patients, we would go and say, hey, go to our patient base, say if you want to share it, you would get vitamins in exchange, but the patients through the app would decide if they get shared data or not. So again, we are simply transacting the economy. Remember, the whole idea about blockchain companies is that we're trying to drive value to the token, so people who hold the token actually get. So a health plan can buy the token, and they will see the value of that token go up as more and more people use that token. So we are administering the ecosystem.
Question in front, sir.
Very quickly, so I'm assuming that you're going to put HIEs out of business.
Yeah, so it's funny. So one of the
Go
biggest
ahead and
things
repeat the
that's a
question.
great. Oh, sorry. Go ahead.
You're assuming we're going to put who out of business? HIE.
Yeah. Health Information Exchanges.
Right.
Yeah. So it's a great, that's a great point. And I think that anybody knows that the HIE model, it's not been as successful as people would thought they were going to be because the participation wasn't there. But you connected the dots nicely. You can see that you connect. And so one of the things that I went to, as soon as I heard this model, people were like, well, how are EHR companies going to be like this? So I went to T. Green, who's a founding chairman of Greenway, which is the third largest ambulatory EHR in the country. And I said, hey, here's what we're doing. He said, Samir, he's like, this data liquidity you're talking about, the HIE was trying to do, and I told him it wasn't going to work 10 years ago. So to your point, I think that, they're kind of, we're not going to put them out of business. They're kind of struggling on their own. But to your point, to your point is this is a model where there's an incentive for the people that actually matter to actually put the data up there, which is what makes the difference.
All right, we have time for a couple more questions, and then we're happy to chat with you one-on-one. Gentleman here on my right.
Very nice talk, thank you. My question is, from the public health perspective, a lot of health registry, immunization, cancer registry. So do you see any conflict or how the public authority, health authority can gather all information from the distributed system and centralize and for the public health?
So the question is, from a public health perspective, there are registries already being maintained of patient information and so forth, and is there any conflict between what you're trying to do with MinHealth and those kinds of public registries? Is that correct?
No, not at all. In fact, the public registries would then tap into our blockchain app, or our cloud storage through the blockchain and get access. So it would help the public registries, because if you're the CDC, right, and you can connect with our APIs in the blockchain, through the blockchain, you can actually pull data, right, on those individuals, because we'll have a global unique identifier. So the patients will be identified through a cryptographic key. So they would be able to pull. It'll actually help the registries, if anything. And in fact, probably not, the setting for this, but there's actually really great applications in the insurance industry around that exact aspect of it. It's like being able to connect different claims data, different information sets to the blockchain, and being able to have a single source of truth. Does that make sense?
Okay, the lady in back.
So, firstly, you said the system is unhackable. So, can it be portable all around the world? It looks like it could be, but when you're using these nodes or the open source code, countries like China would be, they are always trying to get into the system and then infect you with viruses and things.
Well, the question then, if you say it's unhackable, can it be used around the world? Because you feel that could provide a great deal of value, but what about controls and concerns, especially with countries like China that have tried to put control on access to information of various different types? Okay, Samir, you want to?
Yeah, absolutely. I mean, as Jack pointed out, we like to say it's immutable. So in other words, the people who have access to the actual data have to go through the blockchain because the data itself is encrypted. So if you get into the data and it's encrypted at rest and transit, then the only way to get through is through the blockchain. So even if somebody accessed it that they weren't supposed to, you would see who that was. Immediately you would know. So to answer your question it absolutely has applications globally because the Ethereum and the Bitcoin networks and the blockchains, we're not building our own blockchain. We're leveraging existing open source blockchains, which are global. And so the reality is that any patient anywhere would be able to put their records. In fact, South Africa is a country we're looking at closely because they have a very similar profile to the U.S. in terms of private insurance. But yeah, global use of this platform is definitely the idea.
Okay, we're told we have time for one more question. The lady in the zebra top.
My question, the example that you provided was about a patient authorizing their provider to pull data down so that others can have access to it. So that's one patient. How do you expand that so that you're capturing a whole lot of patients and really pushing that out?
No, well,
To repeat the question, that's all right. So I understand, the question is, I understand the idea that a single patient can allow their data to be shared with providers and so forth, but how do you capture the data when you've got a whole lot of patients doing that? Is that a fair restatement?
Get a lot of patients doing that without it being a one by one by one by one by
Right.
one.
Well,
Okay.
that's why, part of phase one of our rollout, we're actually partnering with specific health systems and health plans that are regional. And so what we can do is through an HL7 integration, you can pool the data for all the patients that you know are going to offer it to. So it's actually a really, we've done that and, for all the top 60 HRs, Greenway, Epic, Cerner, where we're able to pull thousands of records into our actual system, into the cloud. So you would just do it through a standard integration.
Yes,
Yeah,
right?
yeah, absolutely, yeah. But typically, yeah, you could do that. Mhm.
Okay, so thank you very much for your time. Please take a minute to fill out the evaluation form. If there are any of you who would like to talk with Samir or me one-on-one, we're happy to chat with you. Thanks again and have a great day.